Canada's nursing shortage has led to a big increase in the recruitment programs overseas, and particularly from the Philippines. Filipino nurses can make more money here in Canada, and their work is needed here. But our recruiting campaigns are straining resources there. CBC's Stephanie Dubois traveled to the Philippines to learn more.
There's so much work to do in this Manila maternity ward. Diapers to change, moms to care for, but not enough nurses.
When there are days that we're short of nurses, I think the most suffering is the patients, especially the quality of care that we provide to them.
Nurse Jay Insila says many are leaving for better opportunities abroad. 10 coworkers have left in the last 6 months. And with dozens needing care in this ward, nurses like Jay pick up the slack.
It's hard, but we get used to it.
But he is fearful for the future.
What will happen to the Filipino people? Who will take care of them?
Several Canadian provinces have been to the Philippines to recruit nurses in the last year. Manitoba among them, seen here making their pitch.
Give and take. We are taking workers from the Republic of the Philippines, but we also want to give back. So we want to give back in terms of incentives.
Filipino health officials say they're short upwards of 350,000 nurses, with private hospitals hit especially hard.
The nursing situation in the Philippines is really not good.
Countries like Canada often turn to one of the hundreds of recruiters in the Philippines to find staff. Jocelyn Adamo is with Filipino Nurses United.
The Philippines is actually a labor exporting country, and we have been #1 supplier of nurses to the world. We have to admit that we have been commodified.
Hundreds of possible applicants stream through this job fair. In Canada, they can make over 7.5 times what they make at home. And more than a dozen countries went looking for nurses in the last year alone.
Just for this month, 4 will be resigning, and they have been given the opportunity to go abroad.
Dr. Urbe Bugay is in charge of a hospital in Bulacan, just outside of Manila. And he says recruitment has become so intense that countries are now hiring new graduates, a pool of nurses that local hospitals typically rely on to staff their wards.
Those recruitment strategy is working for them, for those countries, but not working for us.
Many in the Philippines say nurses need to be paid more, with some making less than $350 Canadian a month. And they need better working conditions.
#safe nurse to patient ratio. And we believe that it would not reach the very critical situation if we take care of our nurses here.
Until those changes are realized, countries like Canada will remain an outlet for Filipino nurses, creating a solution for one country and a growing concern for the other. Stephanie Dubois, CBC News, Manila.
Thank you for watching the CBC Manitoba YouTube channel. Don't forget to like and subscribe. For the latest breaking news and top stories, download the CBC News app.